Tolcapone is a medication used in combination with other medications to treat Parkinson's disease. It belongs to a class of drugs known as COMT inhibitors. Many people with Parkinson's disease experience a wearing off of their medication's effects between scheduled doses, causing symptoms to return or worsen. Tolcapone works by blocking a natural substance in the body that breaks down the medication levodopa, allowing it to last longer in the system and not wear off before the next dose. It is important to take Tolcapone as directed by your doctor and at the recommended times for optimal effectiveness. Take Tolcapone by mouth with or without food as directed by your doctor, usually 3 times daily. You will start on a low dose and your doctor may increase your dosage after 3 weeks if they think you will benefit from a higher dose. The dosage of Tolcapone is based on your medical condition and response to therapy. It's important to use this medication regularly to get the most benefit from it. Try to take it at the same times each day to help you remember. Do not suddenly stop taking this medication unless instructed to do so by your doctor, as it may cause your Parkinson's symptoms to become much worse. If your condition lasts or gets worse, be sure to tell your doctor, especially if your Parkinson's symptoms are not controlled. Some common side effects of Tolcapone include nausea, vomiting, unwanted movements, diarrhea, headache, drowsiness, dizziness, lightheadedness, trouble sleeping, increased number of dreams, increased sweating, dry mouth, gas, and abdominal pain. If any of these effects persist or worsen, notify your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits to you outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, you should still tell your doctor immediately if you experience any serious side effects, such as easy bleeding/bruising, chest pain, fast/irregular heartbeat, fever, mental/mood changes, unusual strong urges, muscle pain, or trouble breathing. Some people taking Tolcapone have reported falling asleep suddenly during their usual daily activities, even without feeling drowsy beforehand. If you experience increased sleepiness or fall asleep during the day, it's important to avoid driving or participating in other potentially dangerous activities until you have discussed this with your doctor. Your risk of this sleep effect is increased by using alcohol or other medications that can make you drowsy. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed above, be sure to contact your doctor or pharmacist. Also, remember to discuss the best timing and daily dosage with your doctor to ensure you are taking Tolcapone safely and effectively. Tolcapone is used to treat a specific problem with levodopa wearing off between doses. However, it can cause a severe liver problem, so it should not be used if you have any liver disease. During treatment, you will need to have regular blood tests to monitor for any liver issues. If you experience symptoms of liver problems such as nausea, abdominal pain, or dark urine, you should stop taking Tolcapone and inform your doctor immediately. If you don't see any improvement after 3 weeks of taking Tolcapone, your doctor may stop the medication. Your doctor may also ask you to sign a consent form acknowledging the potential side effects of Tolcapone. As always, it's important to follow your doctor's instructions and attend all medical appointments during treatment. Before taking Tolcapone, it's important to talk to your doctor or pharmacist if you have any allergies or if you have a history of alcoholism, low blood pressure, severe Parkinson's disease, liver problems, mental or mood disorders, certain muscle problems, or confusion caused by any drug. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you know how this medication affects you. Limiting alcoholic beverages is also recommended. If you are using marijuana, it's important to talk to your doctor. Before undergoing any surgery, make sure to inform your doctor or dentist about all the medications and products you are currently using. Older adults may experience increased sensitivity to the side effects of this medication, such as drowsiness, confusion, and hallucinations. If you are pregnant, you should only use this medication if it is clearly needed. It's important to discuss the potential risks and benefits with your doctor. It is not known if this medication passes into breast milk, so consult your doctor before breastfeeding. When taking Tolcapone, it's important to be aware of potential drug interactions. Certain MAO inhibitors, like isocarboxazid, linezolid, and phenelzine, may interact with Tolcapone. It's also important to use caution when taking other MAO inhibitors like selegiline and razagiline. Additionally, Tolcapone can affect the way other drugs work in your body, including apomorphine, dobutamine, and methyldopa. It's important to discuss all the medications and products you use with your doctor or pharmacist to ensure safe use of Tolcapone. Additionally, be cautious when taking other products that cause drowsiness, such as alcohol, marijuana, antihistamines, and muscle relaxants, and be sure to check the labels on all your medicines to avoid any potential interactions. If you or someone else has taken too much Tolcapone and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can contact a provincial poison control center for assistance. It is important not to share Tolcapone with others. Before starting this medication, it is important to undergo lab and/or medical tests, such as liver function tests. These tests should also be continued while taking Tolcapone. It is important to keep all medical and lab appointments and consult with your doctor for more details. If you forget to take a dose of Tolcapone, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. Make sure to store Tolcapone at room temperature, away from light and moisture, but not in the bathroom. Keep it out of reach of children and pets. Do not flush it down the toilet or pour it into a drain unless instructed. When it's expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.